about arthritis tonight. Okay, again, I figured it out, my knees. Right? So a problem that most of us will have by the time we reach 60s, 70s, etc. So arthritis, or arthritis, arthro, joint, itis, inflammation, okay? Inflammation of the joint, including the cartilage and bone within that joint. That's what arthritis is. It's the leading cause of chronic disability amongst Americans, all right? This is what your knee looks like when you have arthritis. Okay. Some of the symptoms, some of you who might have it might be able to attest to this. You have joint pain, stiffness, your joint locks up, it's hard for it to move. It can swell on you, it can get big, and it can creak when you're moving and walking and things like that, okay? Some of the causes of arthritis, maybe not, it's kind of more recently figuring out what the causes are, but a lot of them are hereditary, developmental causes, metabolic causes, mechanical causes, trauma, and of course what's highlighted in red, weak muscles and obesity. Okay, huge causes of arthritis. So there's two types of arthritis. There's arthritis caused by aging and loss of water and cartilage. So the way your cartilage works in your joints, the more that you use it, the more exercise it has. Let me explain it like this. So cartilage in your joint is basically a sponge, okay? When you're moving it, you start over, one more time. It's a sponge surrounded by fluid, okay, like oil type fluid, okay? When you use that sponge, it compresses, and it opens back up, and it sucks all that good fluid in. When you're running and walking, it compresses, sucks good fluid in, compresses, sucks good fluid in, etc. So it maintains the health. That's the only way cartilage gets nutrients. There's no blood supply in your joint, okay? It gets those nutrients from that oily fluid in your joint, all right? When you sit at home or you're sitting at work and you're not exercising, you're staying sedentary, that sponge just sits there with no fluid, no nutrients flowing in and out of it, okay? So walking around, exercising, things like that, compress it, keeps it healthy. Okay? When you don't do that, you end up with this problem here. Other causes, obesity. If you're overweight, your joints are carrying around more weight, there's more compression on that sponge, it's not going to open up as much as it should. Okay? A lot of compression there, a lot of pressure on those bones, it's going to give you arthritis. Sports injuries. We saw a patient the other day in his 30s with arthritis. That's very unusual, but he played college football, okay, and he ran track. So he had a lot of pounding at a higher rate than most of us do, and that progressed his arthritis, so to speak. And diabetes as well. With diabetes, like Casey mentioned earlier, the blood flow isn't as well as it should be, so therefore the blood flow that goes in, actually supplies that oil with nutrients isn't as good as it should be. So although you may be exercising things like that, you're going to have a lower nutrient content in that fluid than you would if you were non-diabetic. So that's why it's important to follow the things he was talking about earlier. So the first thing you do, you walk into the doctor, you say, "Doc, my knees hurt, man. I've been swelling up on me. I wake up in the morning, it takes me about 30 minutes to loosen up, and I go walk, it feels better, then I cool down, and then it really starts hurting again." First thing I'm gonna do probably is take an x-ray, okay? On an x-ray, the pointer's not working, but I'll show you. Here is a bad knee, okay? This is a shot of the knee, like if we took the x-ray like this, okay? This is your thigh bone, this is your shin bone down here. This is the joint space, and you should see like a black line all the way through it, okay? You can see on this knee, the black line disappears over here, so there's a narrowing in the joint space. It's not a good thing. And you see something called an osteophyte, also known as a bone spur. That's this piece right here, okay? So if you're obese, you're using your knee out a lot, you're not using it like it should, you get arthritic, all this bone pretty much swells up in a sense. It's more of like an adaptation process. So like I said, your body is an amazing machine that can adapt to different stresses on it. So if you're putting a lot of stress on it, things like that, your bone can pretty much overgrow. You get a bone spur in there, and that's what causes it to lock and pop, okay? In addition to all that, you have inflammation, which you can't see on an x-ray. It's causing more pressure in that joint and making it more uncomfortable for you. In addition, you get cartilage loss, because think, right here in this space, there's little to no cartilage right there. So it's bone on bone, and it's not a good feeling, all right? You want to avoid that. Treatments. Go to the doctor, you go to the doctor, so what can I do? Number one treatment is always conservative. You're going to a good doctor, okay? Weight control, exercise, and rest. A 5-pound reduction in weight loss is shown to actually cure arthritis in a certain percentage of people. I can't I don't remember the exact number, so I don't want to just tell you anything, but a reduction of 5 pounds makes a huge difference is the point. 10 pounds, 50 pounds, 20 pounds, obviously a big difference. Exercising. Like I said, you're exercising, you're getting that cushion, the nutrients that it needs, you're getting that cartilage, the nutrients that it needs. And rest. Obviously, if your joint is inflamed, if your knees are hurting, if your back is hurting, your shoulders hurting, if your body is telling you to calm down, chill out, you're doing a great job with exercises, but let's ease into it or just relax for a second, let us cool down a little bit. Wear knee brace. You can wear a knee brace, it compresses it, it keeps the swelling from coming, and it provides you with a little bit of support. So you're not pushing, if you have arthritis at this point, it's not so much bone on bone. Okay, that knee brace is going to support you and give you a little bit of stability. Walking, obviously, is a great idea. Swimming, because it's no impact, so you're not, obviously no impact on your knees. You're swimming, floating through water. Other options, ellipticals and Vikings are great options because there's no impact with those types of exercises. If you have arthritis or pain in your joints, you want to do heat before you work out. Okay, that's going to get the blood flowing to that area and let that part of the body know that it's about to be used. And ice it after. After you work out, there's going to be a lot of inflammation going on, a lot of movement going on. Ice it down. That's going to bring that swelling down. Okay? Heat before, ice after. Heat before, ice after. Now, if that doesn't work for you, if your knee looks like the knee I showed you in the x-ray, there's some other options. NSAIDs, non-steroidal anti-inflammatory drugs. Those are your leaves, your ibuprofens, your aspirins, etc. Okay? Be careful with those. All right? Definitely let a doctor know that you're taking them. And the biggest risk for this are ulcers, peptic ulcers, GI problems. Okay? So if you take them, you overuse them, you can get a stomach bleed. That leads to a host of other problems. Okay? So if you ever had a history of ulcers and your doctor prescribed you these, say, wait a minute, I have an ulcer, I can't take these. Okay? Other options, glucosamine, something that you can buy over the counter at Sam's, at Walmart, etc. And that's a picture of it up there in the corner. Basically, it helps your cartilage out to an extent. Okay? There's a lot of studies that say, does it work, does it not work? You got to try it out and see if it works for you. It usually takes 3 months for it to take an effect. Okay? But another option that you can use, Icy Hot, Bengay, those are topical creams that you put on that joint, on your shoulder, etc. They've been shown to work and they'll leave the pain for the time being, so that's another option you can do. And then the doctor can only do these. Obviously, they have lidocaine, corticosteroid injections, so that's when the doctor injects your knee with the anesthetic. You feel great walking out the doctor's office, okay? Quite honestly, within a few hours it goes away. But this is where the steroid part comes in. So like I said, arthritis evokes an inflammatory reaction. Okay, steroids battle that inflammation. They calm it down. Okay, so that's the benefit of the steroid. So lidocaine has an immediate effect. The steroid is a long-term effect. And 1/3 of them, nothing happens. A couple hours later, after that lidocaine wears off, they're in pain again. Okay. 1/3 temporary, some couple weeks, maybe a month or so, maybe 2 months, then the pain comes back. And 1/3 of that, they don't come back for a year. Okay? You can only do 3 of these injections in a year. Okay? Because steroids have different effects on the body. So you can only do 3 of these in a year, so that's your other option. Another option is what's called viscous supplementation. They actually use a substance from a rooster comb, believe it or not. And it's an oily substance, and you inject it in the knee, and it's basically replacing the fluid in your knee that keeps your cartilage healthy. Okay, so it's like an oily, lubricating substance. It's a series of 3 shots with that one. Some of them are a series of 5. Also pretty decent results with that. And then finally, surgery. If you're older, total knee replacement. You don't want to get them when you're young because knee replacements last about 15 years, and you have to get them redone or revised. Okay? So that's it. In summary, prevention. Start now, okay? Do not wait till the end when your x-ray looks like that one I showed you earlier, all right? You do not want your knee looking like that because it will need to be replaced, all right? Start now. Prevent yourself from getting arthritis. At least try to delay it as much as you can. Keep your cartilage hydrated. Walking, running, elliptical, biking. Keeps that cartilage healthy. Lose weight for obvious reasons. Heat, ice, rest, glucosamine, Icy Hot are the ones that you can take care of yourself. You can go to the store and get those things and treat yourself with these, the heat, ice, rest, glucosamine, and Icy Hot. If that's not working for you, go to the doctor, prescribe you some medications that might help, the non-steroidal anti-inflammatories, might talk about doing injections, etc. And in some people, surgery is the best case scenario. People who get knee replacements usually do pretty well after. Problem is, you gotta wait, usually after 15 years they run out. You gotta replace it or something.